In this video, we're going to assemble and wrap a major surgical pack. So the first thing I'm going to do is just take a look at my surgical instruments here. They were just washed and they have been air drying. So I'm just going to kind of take a glance, just make sure everything looks to be in working order and that there aren't any blood or tissue debris left over on them and that they are fully dry and everything looks okay. So now I'm just going to kind of put everything in the order that I need them to be in. Just assemble my pack. Alright, so now that I have everything in the order that I need it to be in, I'm going to go ahead and just start wrapping or start assembling my pack. So for our surgical packs, we like to put them in a tray just to keep everything kind of where it needs to be. And by standards, some clinics use an actual case tray. Some clinics just use a tray with the towel and wrap itself there. It just kind of depends on the clinic and their protocols. So we've got our surgical tray here. So what I'm going to do is just open my towel and just kind of set my towel inside my tray here. So now I've got that all set up in there. I'm going to start assembling my pack. So the first thing I'm going to do is I'm going to take my scissors. So I've got my medicine ball, my straights, and my Mayo scissors. And we're going to set those down in there first. And I'm going to leave them slightly open. And then the next thing I'm going to place in there now are my Mayo Hagar needle holders. And then now that I have those placed in there, I'm going to get my Rochester Carmalt hemostats. We're just going to place those here on the other side. So we're kind of putting these in order of what the doctor will be using first from top to bottom. And so these are some of the instruments that they will be using last, so they kind of work their way down so they have easy access to it. So the next thing I'm going to put are just my Alice tissue forceps. So now I'm just kind of putting my forceps and my hemostats on one side in kind of descending order from smaller to larger. So now my straight Kelly hemostats. And then we'll move on to our halted, curved mosquito hemostats. And again, I'm just going to make sure that they're kind of open, the ratchets are not closed on these guys. Make sure that these are all in order here. So now that I've got those in order, I'm just going to get my snook and I'm just going to place it here on the top, on the side, and my scalpel blade handle and my Addison Brown tissue forceps. And we like to place those kind of on the side here because those are some of the instruments that the doctor are going to grab first. Now that I have everything in order, if you can see it there, my pack there, I'm going to take my gauze sponges. So we use about 20 of them per major pack. And we're just going to kind of set those here on top of the instruments. And then the other thing I will put in here is a cloth drape. The doctor doesn't always use a cloth drape. Sometimes they use sterile towels, but we like to just give them the option. And then we do take our back house towel clamps and we just set them on top of the gauze sponges because they will be the first things that they use in the instance of using sterile towels on our patient instead of a drape. And then you can also secure the drape on the patient as well. So now that we have everything in there, I'm just going to take my steam indicator strip, which I've put the date on it and my initials, and I'm just going to stick it down here the middle of the pack, and that will let us know that the inside, deepest part of the pack has been penetrated by steam from the autoclave. Next thing I'm going to do is just fold my towel over. So now my pack is looking like this. So now we're just going to kind of get this stuff out of the way. I'm going to set this over to the side. Now I'm going to get my wrap or my linen for my pack. So we're going to start wrapping it. So we use a cloth linen. It can be reused and washed. So I'm just making sure that it's free from debris. I don't see any stains or tears in my cloth here. And we're going to put it in a kind of a diamond shape. So now that we have that, I'm going to take my tray with my instruments and just set it right in the middle and bring this first flap over, and we want to do this fairly tight, and bring this flap back down and fold this over here, and that will create a little flap there. And we're making sure that this, while we're wrapping, we're on a level area free from obstructions, and it's clean. So now we're just going to fold this a little bit and take this flap and pull it tight over, and just fold this part back here to create another little flap. And then we're going to repeat the same thing on the other side. Just fold that over and pull it back. Create a nice little flap, and we're just going to flip it around and just making sure everything is nice and even, and then pull this last part on top there and just tuck it in to our flaps. So now that we have our first inner pack wrapped, we have a nice little pull tab there, we're going to do our outside part. So again, just taking my linen and making sure I don't have any tears or hair. Everything looks pretty good. So now we'll take our pack and just place it again in the middle. And same process. Just going to take this bottom part and just pull it tight over on top, back down, and flip it back over. Make sure everything is nice and even, and again just pull that tight and pull it back for another flap here. Same with this side. Pull it back and for a nice little flap there, and then we'll flip it around. Make sure we got a nice tight wrap on it. And again, just same thing, just tuck it. And so here we have our pack is wrapped with 2 wraps. So now what we'll do is just make sure flap is easy there. So the next step now is I'm going just to get my autoclave tape. I'm going to get a little piece here, and I'm going to just fold one end of it, make it easy to take off, and we're just going to seal that there, and we're going to repeat at the top just to help prevent the pack from opening. So once this is exposed to appropriate steam, these lines on this tape will turn black. So what I'm going to do now is just write the type of pack that it is. So it is a major general surgery pack. And I'm also going to write that I have a medium drape, and I have 20 sponges. I'm also going to put my initials over here on the side, and then I'm going to write the date and my initials again, just because I am the one that wrapped the pack. So we have that finished, and now our pack is ready for sterile autoclave sterilization